Welcome to Medical Compliance Services webpage. We would like to thank you for taking the opportunity to click on our video to hear more about our services. My name is Nancy Horn. I'm a certified professional compliance officer. I'm a member of the Medicare Advisory Board, and I've been working with EMS in Kentucky for 16 years. Phil Horn, our Vice President, has over a decade of corporate management experience. Our company's training has been approved for credit hours by the state of Kentucky for county officials, and all our training materials have been sent to the OIG and was approved. We would like to invite you to look at the OIG HEAT video that talks about compliance for healthcare boards. All healthcare facilities should have some kind of oversight board in order to monitor compliance. You can just Google OIG HEAT video and find it. It's actually the first video listed. Recent corporate integrity agreements have been issued for ambulance services. There have been more audits in the last year than in the last 14 years. An Eastern Kentucky ambulance service had to pay nearly $1 million and had to enter into a CIA with the HHS OIG in 2015. A Central Kentucky ambulance service had to pay $5 million and enter into a CIA with HHS OIG a couple years ago. Tri-County Ambulance entered into a CIA with the HHS OIG in 2014. We're still waiting on the fine amounts and if CIA is going to have to be entered for another Kentucky ambulance service. All this information is available on the OIG website. Goals. The goals of medical compliance services are to establish a working and effective compliance program for the ambulance services. We customize a compliance plan covering the 7 basic elements established by the Office of Inspector General. We assess all areas considered to be a risk area by the OIG and have a policy and procedure in place. We provide required yearly HIPAA compliance and documentation training, and we provide required yearly internal audits. We help ensure the ambulance service is receiving all the revenue in which it is legally entitled to receive. It is not only important to receive payments, but to be able to keep those payments if ever audited by any government agency. Medical compliance services can be viewed as an insurance policy. It is good to have it and not need it rather than to need it and not have it. We have a few clients now that wish they had contracted us before needing us. Cost them a lot of money, but not having things in place to ensure compliance steps have been taken. A proof of a working, effective compliance program can go a long way. Also, when crews learn how to truthfully and accurately document in accordance with regulations, you may see an increase in revenue, but more importantly, if audited by the government, you will be able to keep the revenue you received. Compliance. It's the law. Section 6401 of the Patient Protection and Affordable Care Act of 2010 mandates compliance for all healthcare providers' suppliers. The Affordable Care Act states that a provider of medical or other items or services or supplier shall, doesn't say may, it says shall, establish a compliance program as a condition of enrollment in the Medicare, Medicaid programs, etc. What is a compliance program? It is a system of policies and procedures developed to assure compliance with and conformity to all federal laws governing the ambulance service. It's an ongoing process, a part of the fabric of the ambulance service, a commitment to an ethical way of conducting business, and a system for doing the right thing. It is about prevention, collaboration, detection, and enforcement. In March of 2003, the Office of Inspector General actually published guidance, a compliance guidance for ambulance services. They included 7 basic elements: development of compliance policies and procedures, designation of a compliance officer, education and training programs, internal monitoring and reviews, responding appropriately to detected misconduct. The OIG wants to know that if you have employees that are not following compliance guidance, that you are dealing with that appropriately, that you are not keeping employees on if they refuse to do what they need to do in order to make your company compliant. Developing open lines of communication and enforcing disciplinary standards through well-publicized guidelines. It wants to know your employees understand the importance of compliance, that you have a policy in place, that they may be terminated if they don't adhere to those, and then you have to enforce those disciplinary standards. Federal law prohibits certain individuals and businesses from participating in federally funded healthcare programs. Individuals, entities can be excluded for convictions for program-related fraud and patient abuse, licensing board actions, and default on health education assistance loans. In other words, your employees, if they are in default of a school loan, they could be on an excluded list by the federal government. Under this law, the Office of Inspector General of the Department of Health and Human Services, the OIG, has established a program to exclude individuals and entities in violation of Sections 1128 and 1156 of the Social Security Act, and maintains a list of all currently excluded parties called the List of Excluded Individuals Entities. Here are a list of the exclusion lists. The LEIE is available on the OIG website. It must be checked before hire and every 30 days thereafter for every employee. Kentucky Medicaid exclusion list is available at their website and must be checked before hire and every 30 days thereafter for every employee. And then the GSA has an exclusion list for vendors, and it must be checked every 90 days. So those are 3 exclusion lists that you have to show that you are checking every 30 days and thereafter for every employee, or for every 90 days for vendors. Our strengths: policies and procedures. We customize policies and procedures for 24 risk areas for the ambulance service. We also make sure the wording on the forms used for the ambulance transportation are updated and current. We review these policies and procedures every year to update if any changes need to be made. Training. Our training includes updates on HIPAA and going over privacy and security rules. High-tech rules need to be assessed by qualified IT personnel using the HHS Security Risk Assessment tool, as well as another tool to cover all bases. We go over compliance laws and regulations and read the Code of Conduct to make sure employees understand the importance of the Code of Conduct. We have them sign it in order to keep it in their employee file. Documentation focuses on information from a compliance perspective. We go over forms and train on regulations for each form. The audit process. We look at the documentation from a compliance billing perspective and making sure it matches the training. We verify runs were billed correctly using correct codes and modifiers. We recently discovered that Coventry is not paying claims at appropriate level, and most billing companies are posting the payment and closing the account instead of verifying the payment amount is correct. This is lost revenue for the ambulance service. In January of 2015, HHCA Compliance Today publication had an article by Jason P. Wallace entitled Ambulance Industry Guidance for Intensified Government Oversight. He states the following in his conclusion. With the federal and state government's recent emphasis on ambulance providers, it is imperative that compliance programs are developed and that these programs meet the government's expectations. Thank you for watching our video. Thank you for visiting our website. And please, if you have any questions or need any more information, contact us through our Contact Us link on our website.